How are your aspirations changing as your experience grows?
I think I started thinking bigger. I started my career sort of as a research biochemist. And so, I worked at the molecular level looking at one particular nuclear transport protein. And then I moved to clinical research, and so I worked on a test for a particular type of lymphoma. But it's a very, very narrow type of lymphoma. And then I spent some time overseas, and I worked on, some narrow tropical disease areas. And now, I'm working on Medicare and these large healthcare financing issues. And I think one of the reasons I came back to the US is because we have a lot of potential to do. We have so many resources, which means we have a lot of potential to make huge changes. And sometimes when you work in the international sector, you're making these little marginal changes around the edges. And in the US, we actually have the ability to think really big and to think, how can we make the system different? And it's an exciting time in healthcare because, we had the passage of the Affordable Care Act, also known as Obamacare, and there's a lot of interest, and you see the writing on the wall. The Medicare actuaries always put out a report where they put the long-term projections about where the Medicare program is going and where the different federal and public plans are going. And it doesn't look like we're on a sustainable path. So thinking in these big terms about how you're going to affect, hundreds of millions of beneficiaries, it's pretty exciting stuff. And so I think I've started thinking on a much more broader population level as opposed to at the individual patient level.
And did moving to DC play a role in opening your mind to the possibilities?
Yeah, definitely. I had been in Portland for the previous 5 years, and a lot of the work that we did was very meaningful, but I realized that a lot of what we did was waiting for someone in DC to make policies and decisions that would impact the work we did. And so I guess, looking back to your question about how my aspirations changed, I stopped being just a researcher who responds to research requests and pumps out research at the behest of a funding agency. And now I'm more on the side of trying to influence the policy decisions and influence the research agenda. And one of the projects I'm working on is looking at patient adherence. It's a really sort of great project because patients win if they're able to take their drugs. Medical costs can go down. So it's something that almost every stakeholder feels, whether you're a payer or a provider or a patient, almost everyone. It's one of the few areas in medical research where everyone agrees patient adherence to medications is a good thing. And we're trying to figure out, how do we set the research agenda? How do we, push funders to a certain direction? And previously, we would just sort of wait for the funders to say, this is the agenda that we're driving, and then I would, respond to these research requests and put out research and hope someone read it. And now I'm sort of influencing things on the back end, and that's a lot of what makes being in DC fun. It's where a lot of the decisions are made, and it's where a lot of the public policy, actions are implemented. And having a seat at the table is really empowering feeling.